We, however, thought along a different line. We thought that if we could add other substances to the Q-depressant to try and increase the efficiency of the injection, that maybe that would be a good approach. At that time, the muscle pain and muscle weakness was treated with magnesium sulfate. Excuse me. So we added magnesium sulfate to the injection. Calfozan, which is a calcium phosphate catalyst, was added to the injection to increase the efficiency of the magnesium sulfate entering the muscle cell, the myocyte. B12 and folic acid were common tonics used in Britain for the treatment of chronic fatigue. So we added both B12 and folic acid. Lately, we have also added glutathione, which has been under investigation. And lastly, trace elements were added to the injection. So this complex injection of these various substances increased the efficiency of the treatment. And we have found that patients actually can benefit from this particular approach. As an adjunct to the weekly Q-depressant injection, we use daily capsules, either 1 or 2 capsules per day, of immunoprop. This is a glutathione L-cysteine capsule. This is taken with the idea of assisting the immune system. Other workers have determined or claim that low-dose naltrexone is helpful. The idea in this particular substance is that low-dose naltrexone blocks the immune system and actually downregulates the cytokine excretion. A company in Ireland has produced a substance called Immunovir, which is again a substance which is claimed to affect the cytokine production. Both these latter substances, Immunovir and low-dose naltrexone, have not actually been widely used, and we are still awaiting long-term testing. The question about contagion is always actually asked. Is chronic fatigue syndrome contagious? Is it infectious? The answer is no. Obviously, at some particular point, if one believes that this is a post-viral fatigue, that the virus actually passed from one patient to another. But by the time the chronic fatigue syndrome has been diagnosed, the virus has long passed its infectious state. Another question that is asked, what is its relationship to Gulf War syndrome? Well, Gulf War syndrome and chronic fatigue have similar set of symptoms. We don't know what causes Gulf War syndrome, so we cannot actually make a correlation or answer the question specifically. How is this disease being researched? The answer is very poorly. The government put certain funds aside for chronic fatigue syndrome research. But the CDC took this money and used it for research into other conditions. And some of the funds that were earmarked disappeared. So the answer is very, very little money is actually spent on research for this particular disease, unfortunately. What do we have to look for in the future? Well, hopefully we will actually be able to define what the cause of the disease is distinctly and how best to treat it. At the moment, we are trying to actually treat a disease, and hopefully sometime in the future we will have many more answers. Thank you very much.